Gallstones. Gallstones are one of the issues that can arise as a result of the buildup of certain substances such as cholesterol, which can range in size from sand grains to larger grains. Bile, which is produced by the liver and aids in fat digestion, is stored in the gallbladder sac. Through small passageways called the bladder and bile ducts, this juice passes from the gallbladder sac to the small intestine. The majority of gallstones do not cause any difficulties, but if they clog the gallbladder ducts, they must be treated right once. Gallstone symptoms. The majority of persons with cholecystitis have no symptoms, however some have, such as the following. Moderate abdominal pain, especially in the upper right quadrant. Back pain on the upper right side, or towards the right shoulder. Discomfort when eating. Bile duct obstruction symptoms. The following are the signs and symptoms of gallstones blocking the bile duct. Fever and aches and pains. Skin discoloration. The color of the eyes is lightened. In such circumstances, it is best to see a doctor right away because the accumulation of stones in the gallbladder ducts raises the risk of pancreatitis. The treating doctor should be contacted promptly and without delay if there is sudden and severe pain in the abdominal or chest area, and the true origin of the discomfort is unknown, as the symptoms of gallstones are extremely similar to the symptoms of abrupt pain in the event of a heart attack. Gallstones causes and risk factors. In circumstances when the gallbladder bag is not drained adequately, gallstones form when cholesterol joins with other components that make up bile. Gallstones are more likely to develop in people who are overweight or trying to lose weight as quickly as possible. Gallstone complications. Gallstones can cause a variety of complications, including cholecystitis is a kind of cholecystitis. The bile duct is obstructed. Pancreatic duct obstruction. Cancer of the gallbladder. Diagnosis of gallbladder stones. When you have symptoms in your abdominal cavity, you should see your doctor to get a diagnosis. The doctor will ask you questions about the nature of the pains, when they first appeared, where they are now, and whether they are permanent or come and go. The doctor is likely to recommend a variety of imaging procedures, such as ultrasound, to visualize the body from the inside. A gallbladder bag examination can also be done, in which the doctor injects a dye, pigment, into a vein in the arm of the patient, then takes x-rays while the dye flows into the liver, gallbladder ducts, gallbladder bag, and intestine, detecting any gallstones. Treatment for gallstones. In the event of a moderate episode of pain, the doctor may recommend taking painkillers, then waiting to see if the pain will go away as a result of this therapy or not. In some situations, another attack occurs, which is monitored for developments, and this usually does not create any consequences. The treating doctor may prescribe surgical removal of the gallbladder if the patient has a significant acute pain attack, as this indicates the possibility of future attacks. Surgery. Gallbladder removal surgery is conducted on a large number of patients, and it is generally done without difficulties thanks to laparoscopic surgery, which involves the physician making a series of small incisions in the abdominal cavity and then withdrawing the gallbladder bag via them. Within 1 to 2 weeks after surgery, the majority of patients are able to resume their routine activities. To remove the gallbladder bag, the surgeon may need to create a bigger incision in the belly. The healing time is lengthier in such circumstances. Gallstones prevention. Gallstones can be avoided in a variety of situations, including: make an effort to keep a healthy weight. Reduce your weight gradually. Make sure you are getting enough fiber in your diet.